Hello, my friends. I'm Dr. Linda Parker, Senior Health and Longevity Specialist, and today I want to talk with you about something that almost no one explains clearly once you turn 70. Cholesterol tests. For decades, you've been told that the secret to avoiding a heart attack is to keep your numbers in line and to test over and over again. But after a certain age, that story changes. The same tests that were useful at 50 can become confusing, anxiety-producing, and sometimes even harmful at 75. No one told you that the rules shift with age, but they do. Before we go any further, let me be crystal clear. This is an educational conversation, not personal medical advice. I am not telling you to refuse every test your doctor orders. I am inviting you to understand which cholesterol tests are truly helpful for someone over 70, which ones add very little value, and how to ask smart questions so that every test you agree to has a clear purpose. You and your doctor should always make the final decision together. Now, why does this matter so much? Because many older adults are living with a quiet, constant fear of their lab results. Every few months, come back fasting, we'll repeat your cholesterol. You sit in the waiting room, get your blood drawn, wait for the numbers, and then perhaps a new pill is added, the dose is increased, or yet another test is suggested. Meanwhile, your day-to-day life, your ability to walk, to breathe comfortably, to enjoy time with the people you love, may not change at all. When we focus too much on lab numbers and not enough on how you actually feel and function, we risk turning healthcare into a numbers game instead of a quality of life game. To understand which tests to question, we need a simple picture of cholesterol itself. Cholesterol is a waxy, fat-like substance that your body actually needs. It plays a role in hormone production, vitamin D synthesis, and the structure of your cell membranes. The problem is not cholesterol existing in your blood. The problem is how certain types of cholesterol, over many years, can contribute to plaque buildup in the arteries that feed your heart and brain. These are the fatty, inflammatory deposits that can narrow blood vessels and increase the risk of heart attack and stroke. A standard cholesterol panel usually reports several numbers: total cholesterol, LDL, or LOWDENSITY, HDL, or HIGHDENSITY, and triglycerides. In younger adults, aggressively lowering LDL can significantly reduce the risk of heart disease over the following 2 or 3 decades, but after 70, the story gets more complicated. Plaque has already had many years to develop. Your body's response to medications, your vulnerability to side effects, and your overall life expectancy all become central issues. In some older adults, chasing very low cholesterol numbers with more and more testing and higher doses of medication adds more fatigue, muscle pain, and drug interactions than actual benefit. So the real question is not, can we lower this number a little bit more? Instead, it becomes, will lowering this number further actually improve my remaining years of life in a meaningful way? That's the question many older patients are never encouraged to ask, and that's exactly where 3 common cholesterol-related tests, routinely ordered in people over 70, often deserve to be questioned, sometimes even refused, after a careful talk with your doctor. Let's start with the first one. The first cholesterol test to question after age 70 is the automatic, frequent, fasting cholesterol panel in someone whose treatment is already stable and whose life expectancy is limited. In plain language, if you're over 70, you've been on the same cholesterol medication for years. Your numbers are reasonably controlled, and you have multiple other serious health issues. Repeating cholesterol labs every few months often doesn't change anything important. You still take the same pill at the same dose. Why can this be a problem? Because every abnormal number triggers anxiety, follow-up appointments, dose changes, sometimes new medications, and occasionally side effects such as muscle pain, liver test abnormalities, or dangerous interactions with other drugs you take for blood pressure, diabetes, or pain. Over time, you may find yourself on a long list of pills that make you feel more tired and frail, all in the name of chasing a slightly lower LDL number. In many older adults with advanced heart disease, advanced kidney problems, or other serious conditions, the benefit of repeatedly adjusting cholesterol medication becomes very small, especially if their remaining life expectancy is under 10 years. What often matters more is controlling symptoms, shortness of breath, chest discomfort, leg swelling, and supporting mobility, strength, and independence. If another cholesterol panel won't change your treatment, it may be reasonable to ask whether you truly need it. A simple way to start that conversation with your doctor is this. If we repeat my cholesterol today, and it's a little higher or lower, will that change any of my medications in a way that clearly improves my health or longevity? If the honest answer is no, or probably not, then it might be a test you choose to refuse. On the other hand, if your doctor can explain how the result will guide a specific, meaningful decision, such as adjusting therapy after a recent heart attack, that's different. The goal is not rebellion. The goal is clarity. Now let's look at the second cholesterol-related test to question, the advanced, fancy cholesterol panels promoted as ultra-precise in older adults who already have a clear treatment plan. You may have seen these advertised as particle-size tests, NMR lipid profiles, or premium cholesterol panels. They measure not just LDL and HDL, but the number and size of particles, additional apolipoproteins, and a variety of markers that look scientifically impressive on paper. There are situations where some of these tests can be helpful, especially in younger or middle-aged adults with borderline risk, unclear family history, or unusual findings. However, in many people over 70, especially those who already have diagnosed cardiovascular disease and are already on cholesterol-lowering medication, these advanced panels rarely change the treatment plan. Your doctor already knows you're at high risk because of your age and history. The decision to use a statin or other therapy is driven mainly by that reality, not by the exact pattern of particle sizes in your blood. These advanced tests can be expensive, may not be fully covered by insurance, and often lead to cascading discussions about tiny differences in numbers that do not translate into better health outcomes for someone in their 70s or 80s. You might end up with additional medications layered onto your existing prescription list in pursuit of idealized lab targets that offer very modest benefits at your stage of life. Meanwhile, each new drug brings potential side effects, digestive issues, sleep problems, muscle pain, that can reduce your day-to-day comfort. So, before you agree to an advanced cholesterol panel, ask your doctor, how will the results of this more complex test change what we actually do? If the answer is essentially, we'll keep you on the same medication and lifestyle plan, you have every right to say, then I prefer to skip it. If, however, there is a specific clinical question, perhaps you've had unusual side effects or an unclear response to treatment, then a targeted advanced test might still be reasonable. The key is that the test must be tied to a clear, concrete decision, not ordered just because your age and cholesterol history make you an easy candidate for more testing. The third type of cholesterol-related test to question after 70 is the aggressive, imaging-based plaque screening, done just because your cholesterol is elevated, without symptoms or a clear plan for what to do with the result. These are tests like coronary artery calcium scoring CT scans, CT angiography of the heart, or screening carotid ultrasounds in people who have no symptoms of heart or brain disease. Again, these tools are not inherently bad. When used appropriately and selectively, they can provide valuable information. The problem is when they are ordered reflexively, simply because someone has high cholesterol, without considering age, overall health, and what will actually change if a plaque is found. Imaging tests carry their own risks. CT scans involve radiation exposure and sometimes contrast dye, which can stress the kidneys. Abnormal findings, like small plaques or mild narrowing of arteries, are extremely common in older adults, especially those who have had high cholesterol for many years. Once those findings appear on a report, the pressure to do something increases. More medications, more follow-up scans, sometimes even invasive procedures that may not improve quality or length of life in someone who is otherwise stable. Imagine an 80-year-old man with mild high cholesterol, controlled blood pressure, no chest pain, and good functional capacity. If a coronary calcium scan reveals moderate plaque, the response may simply be, continue the medication you're already taking and focus on lifestyle. In that case, the scan added fear, but not meaningful new action. On the other hand, if he suddenly develops chest pain with exertion, a targeted heart evaluation is important because it's driven by symptoms that could represent a real, immediate threat. When your doctor proposes an imaging test to check your arteries just because your cholesterol is a bit high, one powerful question is, if this scan finds mild or moderate plaque, what will we do differently than we're already doing? If the answer is vague or essentially, we'll just know more, then you may choose to decline it. If, however, your doctor explains that there is a specific concern based on symptoms, exam findings, or a very strong family history, that's a different discussion. The point is that imaging should not be a fishing expedition driven only by numbers on a cholesterol panel, especially in older adults. Now, you might be wondering, if I start refusing some of these tests, am I putting myself at risk? The real risk is not in refusing unnecessary tests. It's in allowing your care to be driven by automatic protocols rather than thoughtful, individualized decisions. There are many situations where cholesterol testing remains extremely important after 70. If you've recently had a heart attack, a stroke, or a procedure like stent placement or bypass surgery, monitoring your cholesterol helps your doctor see whether treatment is working. If you're starting a new medication that can affect liver function or lipid levels, early follow-up labs can be very useful. What we are talking about today is not walking away from cholesterol care. It's shifting from automatic, repetitive testing to strategic, meaningful testing. For many older adults, the most powerful heart protection comes from consistent, simple habits. Walking daily or doing gentle activity that matches your abilities. Eating more vegetables and fiber and less processed food, not smoking, taking essential medications that have already proven their value, and staying socially and mentally engaged. None of those depend on repeating a cholesterol test every 3 months. I'd like to bring this down from theory into real life by sharing a few brief examples. A 76-year-old woman came to see me with a folder full of lab reports. Her previous doctor had been ordering advanced cholesterol panels every 6 months, along with frequent imaging scans, even though she had mild coronary disease that had been stable for years. Every time a minor marker went up or down, she was told, "We need to watch this closely," and another test was scheduled. She was exhausted, frightened of her own body, and taking multiple medications that gave her muscle aches and severe fatigue. When we reviewed her history carefully, we realized that none of those extra tests had changed her treatment in a meaningful way. We simplified her regimen to one well-tolerated cholesterol medication, one blood pressure pill, and a manageable walking program. We agreed to monitor her cholesterol once a year unless a specific issue arose. Her energy improved, her fear decreased, and her quality of life expanded, not because we ignored her heart health, but because we focused on the parts of her care that truly mattered. Another patient, an 81-year-old man, had been sent for a coronary artery calcium scan just because he was over 80 with high cholesterol. The scan showed significant plaque, which was no surprise at his age. He was then referred for more imaging and a discussion about invasive procedures. But he had no chest pain, no shortness of breath, and could still walk several blocks without difficulty. When we reviewed his overall health, we decided that aggressive interventions would not meaningfully extend his life and might actually reduce his independence. He chose to keep taking his medications, remain active, and decline further invasive testing. 3 years later, he was still living independently, enjoying his garden and his grandchildren. Then there was a 72-year-old woman who had always been terrified of cholesterol numbers. When her doctor suggested an advanced lipoprotein panel and a carotid ultrasound to be thorough, she paused and asked the question I teach all of my patients. If these tests show more risk, what will we do differently? Her doctor admitted that the plan would remain the same. Continue her current medication, encourage exercise, and watch her blood pressure. With that clarity, she decided to refuse those tests. Instead of more appointments and more fear, she focused on walking with a friend 3 times a week and preparing simple, heart-friendly meals at home. None of these people were reckless. They were informed. They understood that after 70, the value of a test is measured not by how much it impresses us on paper, but by how directly it improves daily life and realistic long-term outcomes. So if you're over 70 right now, or you love someone who is, how can you apply this in your own life? Start by making a simple commitment. You will not accept any cholesterol-related test without understanding why it's being ordered, what decisions it will guide, and how those decisions could realistically improve length or quality of life. You can say to your doctor calmly and respectfully, "I'm not against testing, but at my age, I want every test to have a clear reason. Can you help me understand what we'll do differently depending on the result?" That one sentence changes the entire tone of the visit. It transforms you from a passive recipient of orders into an active partner in your care. Remember, refusing or questioning a test is not a sign of disrespect. It is a sign of responsibility. You are the one who lives with the consequences, emotional, physical, and financial, of every test and every treatment. A good clinician will welcome your questions. If a test truly matters, they will be able to explain why in simple, honest language. Let me leave you with one powerful idea, condensed into a single sentence. After 70, the best cholesterol strategy is not to chase perfect numbers, but to choose tests and treatments that genuinely protect your remaining years of life and your day-to-day well-being. It is never too late to support your heart, your circulation, and your overall vitality. Even small changes, more gentle movement, a little less processed food, a consistent sleep routine, taking only the medications you truly need, can make a real difference. And when you combine those habits with wise, selective testing instead of automatic, fear-driven testing, you reclaim a sense of peace and control over your health. If this message resonated with you, I invite you to reflect on your current testing routine. Are you getting labs and scans that actually change your care, or are you repeating tests just because? Talk with your doctor. Share this perspective with a friend or family member who is over 70. And if you're watching this on a platform like YouTube, consider subscribing so you don't miss future conversations about senior health, vitality, and informed decision-making. I'm Dr. Linda Parker, thanking you for spending this time with me. Your body, even in your 70s, still has remarkable potential. Don't let unnecessary tests steal your peace. Use them wisely, question them when needed, and always remember, your health care should serve your life, not the other way around.